I think a lot about the line between medical education and marketing. It's blurry, and our study suggests that this may be by design. We were particularly interested in this because what companies say to regulators to get their drugs approved can be quite different from how they train their sales representatives to talk about those same drugs. We really wanted to understand how Mallinckrodt, the largest generic opioid manufacturer, actually went about selling its brand name opioids in the early 2010s, right when opioids were being prescribed at extremely high volumes. Not the press releases, not the talking points, the real internal playbook. So we dug into hundreds of internal documents from the UCSF, Johns Hopkins Opioid Industry Documents Archive, emails, performance reviews, everything we could find from Mallinckrodt's Operation Change Agent, a campaign to switch patients from OxyContin to Mallinckrodt manufactured painkillers. What we found was that marketing efforts weren't just about handing out brochures to healthcare providers. Mallinckrodt trained representatives to play on prescriber worries about increasing public regulations on OxyContin in order to get prescribers to switch patients over to Exalgo. They explicitly trained sales representatives to use emotional storytelling, get over prescriber hesitancies, and even designed iPad apps to help representatives counter prescriber objections on the spot. And they designed sales contests to motivate reps to sell even more prescriptions. So, what does our study add? It really helps build the case that behind the scenes at Mallinckrodt, there was often very little discussion of information or education about the potential dangers of using opioid medication. Instead, their strategy focused on expanding market share regardless of the cost to the health of patients. Only by being able to access these internal documents can we understand how calculated and coordinated these marketing efforts truly were.